some states have actually aggressively, as you know, integrated paid caregivers with family members. California, for example, is what, 66% of the family caregivers are also paid caregivers at this point. And I think it's a good thing that this is an opportunity for people to make money doing what they're going to do anyway. Right. I do have concerns about training for those folks over time. This is the whole consumer choice movement or discussion that's taken place. There is an increasing interest. There has been over years in the interest of sort of this assisted living or nursing home without walls in communities where you'd have people live sort of in contiguous areas so that you could use some economies of scale caring for people and supporting their family caregivers at the same time. And then there's the culture change movement, which is taking place in residential care. Nursing homes. Sort of the one that everybody's heard of is greenhouse movement. Which is great, but there are only 170 greenhouse residences in the United States at this point. And so that's a limited number of people who will participate in that, can participate in that.
I know you like to travel and have been to lots of places. In all of your travels, where in the world are they getting it right, if anywhere?
In other places, more deliberately, there are numbers of churches, often black churches, which are building on the tradition of the nurses. So there's this tradition of nurses in black churches, which in some places are women generally who dress in real nurse garb, and they were there to help people as they became exhausted during services, who've begun to sort of begun to engage around long-term care issues, and very often these are younger women. I remember being in a training here in suburban Cook County that was being part of a project that Age Options, which is the area agency on aging, was running. 7 black churches involved in a project. On my left was a woman who couldn't have been more than 26 or 27, like you. And on my right was a woman who had to be in her 90s. Woman 26 or 27 was caring for her much older, obviously I think it was her great aunt, right? Probably a woman in her 80s. Woman on my right, a woman in her 90s, was caring for her older sister. And if I pushed back and I heard the two of them talk, they're having the same conversation, and they're talking about the same exact things. What was inspiring about that is that they were part of this community that wrapped itself around their members, using that tradition to support their members where they had to. I thought that got it right.
Well, what kind of policy could actually support initiatives like that? And do they exist anywhere?
Well, I think there is something to be said for figuring out a way to make consumer choice work effectively if people were paid enough to actually carry out the work that they need to do.
So let's unpack that for a second. What's consumer choice?
So consumer choice is when the recipient of care can actually choose who it is that cares for them, right?
And then the pay part.
And the pay part is that people who are doing consumer choice care and are paid are often doing it based on Medicaid rates. And so they're getting paid, $8, $10, $12 an hour.
12 is high.
12 is high, right. Because they're perceived as being family caregivers, which they are, they're then not organized. And as a result of not being organized, they don't have bargaining power. I mean, unions are right. Workers don't get treated well if they're not organized. So I think policy which allowed people in general to get paid a living wage, which required training for people so that they could do the jobs that they do in an effective way, and encourage people to organize in a way that supported each other would be really good public policy. And you can do that in places like those churches I was talking about, because you already have a social basis for that to actually happen.